Racism against nurses working in Britain's hospitals has soared 55% in the last 3 years, according to data released by the Nurses Union today. While those figures are shocking, they warn that most incidents actually go unreported, so the true figures are likely to be much higher.
Neomi Bennett has had to deal with verbal assaults and has even had patients refuse care because of her ethnicity. She has since launched a movement to support black nurses who suffer racial discrimination in the workplace. We'll chat to her in just a moment. But first, here are some eye-opening accounts of staff members from the Royal College of Nursing report.
I want to remind you that you're not one of us.
Then you shouldn't have come to the UK.
A patient called me and my colleagues slaves.
And Naomi joins us now. I mean, it's so kind of distressing to read this survey. And, you know, thank you for the work that you do for our National Health Service. It's so important what you do. So it's so terrible that you and colleagues have been treated in this way, but it's also on the rise.
Yeah.
What is happening to our country at the moment? Is it social media? Do people feel emboldened to speak out because they read things online? Is something else? Is our politics to blame? Why is this happening, do you think?
I think it's a combination of lots of different factors, including the, you know, the state of the, you know, the country at the moment as a whole. There's a lot of hostility to immigrants, people coming to the country, you know, and the recent protests that took place in London. I think it's so more... Racism has become so open and normalised, and people are emboldened to just, you know, perpetuate it.
Right.
Yeah, and in hospitals in particular, because, you know, there's a hierarchy within hospitals, and there's room there for people to take advantage of the system and actually penalise many of the workers with, you know, such as referrals to the NMC and other complaints. So I think, yeah, social media people are very much more comfortable to, you know, basically racially make racial comments that are very offensive. And then I guess when it becomes dangerous is when people act on that, when they act on it and use the processes and procedures and policies to, you know, to weaponise against ethnic minority and more particular black nurses.
I was really shocked to see some of the things that have been said, but for you, you've had experience of this on a regular basis, would you say?
Yeah, absolutely. So I'm a nurse, and I had a completely completely clean record. And my first serious experience with systemic racism was when I was stop and searched by the police, and I was completely innocent. And basically, I tried to sort of find out what it was that the police were stopping me for, and they couldn't actually tell me why. But when I asked for a female officer, and I said I was frightened because obviously black people in my community, the police have always been kind of, you know, it's a bit worrying. But basically, I ended up getting arrested. They took me back to the police station and locked me up. And basically, I still in my mind kept thinking, you know, I'm a nurse and I've not done anything wrong, and I trust the justice system because I thought, you know, I'll be exonerated. However, shockingly, I went to the magistrate's court and I was found guilty. They said I took too long to get out of the car. They said I had illegally tinted windows. None of it was true. But the problem is, when you're in that institution and you're fighting on your own, it almost feels impossible. And what we find now is, like, after that, I noticed that there's a similar systemic problem in the NHS. So it's almost like the regulator has identified that a disproportionate number of black nurses are referred to the regulator, to the NMC, and usually it's because it's been weaponised against nurses. You know, but the psychological damage it does, it's unbelievable. So what I did, with my experience with the police, having to fight to clear my name, eventually I did, I've set up Equality for Black Nurses, and we support nurses at the NMC, at employment tribunals, even at employer level. But the thing is, at the time you're going through it, I couldn't really I couldn't really verbalise it. And the thing is, as a black nurse, you can't always just say, I think this is racism, because it doesn't present itself in a way that you can verbalise it. So you can feel yourself going through it, you know, all the little remarks your colleagues may make, you know. And even once when I was working in the hospital and the patient actually asked for a white nurse, and the matron and the staff, what they did is they basically supported the patient, gave the patient a white nurse, and then later on sacked me for gross misconduct because they said, you know, when the patient told you to come out the cubicle, you should have just left, instead of saying to the patient, you know, you can't choose. So I think that kind of, it's very traumatic. It's very traumatic because you can't, you know, for somebody not to want you to care for them because of the colour of your skin, it goes against the grain of what we do.
Can I ask you about the debate we've had in politics in the last couple of days about the Reform MP, Sarah Potchin? I don't know whether you've seen this. She was on Talk TV and a viewer was kind of calling in saying that white men were being excluded from TV adverts. And she said, absolutely right, it drives me mad when I see adverts full of black people, full of Asian people. She's then apologised.
Yeah.
It's clearly racist. How do you feel when you hear an elected member of Parliament saying there are too many Asian and black people on TV? I mean, she, you know, there'll be people saying too many Asian and black nurses in the hospital? Yeah,
that's exactly the message we're getting, and it's absolutely so irresponsible for somebody to say something like that. And I've actually seen some of the reports, and a lot of people are supporting her, saying, oh, it's not racist, she just wants to air her opinion. But it's really dangerous, and I think people with that kind of idea and mindset going into the hospital, you know, it's not just migrants, it's your skin colour. I was born in the UK, but even I face hostility from patients sometimes and colleagues. So something like that, it was actually quite, it's worrying the state that we're in. You know, it's actually, it's really disappointing to hear somebody saying that. And also, like, these apologies that we get afterwards, like, you can't say something like that and impact so many people and then just say, oh, sorry, it's fine. It's about accountability. There needs to be accountability for those kind of comments.
So people need to think more in advance. OK, so if you've just got sort of a top line, you know, what needs to change? Is it zero tolerance? What would help tackle this, do you think? OK,
so we need accountability, not diversity panels and promises. We need regulators and NHS trusts to stop weaponising referrals, stop, you know, stop blaming, like, black and ethnic minority staff when things go wrong. We need transparency, we need openness. Stop blaming us. And, you know, a lot of it is because they may not want to report figures to the government or whatever, but at the end of the day, black nurses, you know, we work really hard and we just want to be accepted and we just want to care for our patients.
As you should be able to do. Thank you so much for coming in to talk to us about that this morning.
Thank you.
We asked the Department of Health for a statement and they told us, our thoughts are with the victims of this vile abuse. The Prime Minister has ordered an urgent review of all forms of racism in the NHS as part of wider efforts to tackle discrimination in the health service. And Naomi, thank you for talking to us about that today.
Racism in nursing, it doesn't look like name-calling. It looks like being over-scrutinised and being treated differently from your colleagues.
So it can actually be a lot more complex.
Clear.
Yeah.
Thank you.
Thank you so much.